So, and we go to the slides, and we try to make it full screen. And one more time, like this. Now, have you done these sentences? Have you written them, or do you need more time to finish the task?
Ma'am, we have written.
Yes, ma'am. No need extra time.
I see. Okay. I don't know whom to address because. So, anyway, let's listen to the ladies whom I can see. Mayuka, please, the first sentence, number 5.
Yes, ma'am. If I had a chance to do the whole thing again, I think it's hypothetical.
Mm-hmm.
And the next sentence will be, I would prepare for the consultation better.
Mm-hmm. Yes. So, but we never have a chance to do something for the second time. Yeah. So,
Yes.
You're right. So please, Bhargavi, number 6.
Yes, ma'am. If you bring the child in on the 23rd November, I think it's real, and we will carry out the 6-week check. Check.
Exactly right, because if it is real, we use future simple. We will carry out. Okay, so there is yes. So Hita, please.
Yes, ma'am. If you give him the solution in little sips, it's real, ma'am. And the second part is it will help him stop. It will help stop him from bringing it up.
It will help. It will help stop him. Yes, you're right. Okay, and who else is here? Rina, please.
If I had to talk to the mother again, it is real, ma'am. I would certainly be a lot more sympathetic.
Is it real? The past tense, it's hypothetical situation, imaginary situation, because I'm not going to meet mother again. So I mean, somebody's mother maybe. So, but the tense is right. If I had to talk, I would certainly be. Right. Okay, so this is the way the tenses are used in the conditional structures, and you should always think about how real or unreal situation is, and analyze and use the correct tense in the first conditional or second conditional clause. And here there are some phrases that doctor used to reassure parents. So reassuring parents with young children and babies in order to relieve anxiety is a challenge. And we should decide whether the doctor's statements made to parents are reassuring or not reassuring. And we should give reasons for your answers. So the first statement, Pradeep, are you here? Rohita?
Yes, ma'am.
So please, the first phrase, will you read it, please?
Fortunately, only a very small percentage of babies go on to develop permanent damage. Let's hope Jan is not one of them.
So is this just a statement reassuring?
Statement, ma'am.
Is this phrase, these sentences, what the doctor says, is it reassuring for a parent? So he says, fortunately, it's good. But on the other hand, he says, Let's hope Jane is not one of them. He says like, let's hope, and will the parents stop worrying? Parents stop worrying about the child's condition if he just hears such a phrase. So I think it's not reassuring enough, right? So the doctor should say something more optimistic, or just change the structure of the phrase. Okay, Bhuvanesh, hello. Bhuvanesh minus. Sohita, please. Number 2.
Yes, ma'am. Rashes are very common and not every rash leads to meningitis, but it is good that you are alert to this. It is reassuring, ma'am, because they are telling that not every rash leads to meningitis and that it's good that they are alert to this.
Yes, yes, okay, good, thank you. So then Afnan is absent. Khadija, are you here? No. Mosharafuddin? Minus. And so Mayuka.
If you are about 6.5 and couldn't say certain consonants like S, F, and TH, we'd probably have to look into it. I think it's not reassuring.
Why?
Because he's talking about the illness, I guess.
First of
And
all,
there is a lot of chance of this. Probably have to look into it.
So this sentence, what makes this sentence reassuring is the use of the second conditional structure. Because the doctor speaks about imaginary situation like the situation which is not related to this child. So the doctor uses if he were, and couldn't say the consonants like s, f, th. But the situation is different with the child. That is why this sentence sounds reassuring to a parent. So, okay, and Rina, please.
Many parents recently have bought their child in with exactly the same rash, but there is a viral rash going around. I think it is reassuring, ma'am.
So reassuring that there are a lot of other parents with the same situation, and so everything is all right with their children. Okay. Well, the next is for Bhargavi, please.
Yes, ma'am. I can assure you if there is a fracture of femur from the delivery, it's nothing to worry about. I think it's reassuring because he's removing the fear of the women, particular women. Yes.
On the other side, we can say the doctor says uses their which conditional, first or second?
First one.
First. So he's speaking that the danger is real. He says that the danger is real. So
Yeah.
He says it's nothing to worry about, but the danger is real. So the use of the present, the first conditional sounds less reassuring than the use of the second conditional. So this sentence is less reassuring. Okay, then Vidya, is Vidya here? No.
Yes, ma'am, I'm here.
Okay, so please, number 6 is for you.
Epiglottis is very rare here now, but we have a few cases recently, ma'am. It's reassuring because he is using real thing like rare here now.
Mhm. Okay, so, anyway, the doctor says that they've had a few cases. So it doesn't help a parent to calm down about this. So it's not very reassuring. And the next one is for Lahari.
Yes, ma'am.
Mhm.
If he had a brain tumor, the rise in pressure in his head would be much slower.
Mhm.
I think it's assuring, ma'am.
So here
Not-
there is the second conditional structure. So, and do we say that to sound more reassuring, we need to use the second conditional. So it is. Well, and if we have a look at the next slide here, there is a case. So, and we should make a list of possible statements you might use to reassure the parents in the following situation. Mr. and Mrs. Barton are anxious about their child, Robert, who has had several bouts of febrile convulsions and might develop epilepsy. We should reassure his parent that their 3-year-old child is not suffering from epilepsy and reassure them about the future. So is the case clear? Three-year-old child and has had several bouts of febrile convulsions. But we should say it's not epilepsy, and we should use second conditional structures, right? And some other just phrases that convince his parents that it's not very serious. So please write some possible statements that you might use in this situation when you talk to a parent, to his parents. So just a couple of minutes for you. So let us share what we've written. Rohita, please. What would you say to the parents in this situation? Rohita?
Ma'am,
Yes. Do you have any brilliant ideas?
No, ma'am.
I see. Let us listen to Sohita then.
Yes, ma'am. If it were epilepsy, he wouldn't have high fever.
Okay.
Maybe. I don't know if it's right or wrong.
So let's hope
Because-
it's right. Mhm, mhm. From the medical point of view, I'm not sure, but from the grammatical, it's all right. Yes.
Yes.
Any more ideas, ladies?
If he had epilepsy, then his body would be stiffened. So there is nothing to worry because his body is not stiffened.
Mhm, okay. So, anything else?
If it were epilepsy, it might caused from brain injuries or genetic disorders. I guess there are no this kind of features for the patient, I mean the child. So there is nothing to worry about.
Mhm.
And if
Yes.
it epilepsy, then he would have loss of consciousness.
Exactly, yes. Mhm. Anyway, so they should do some more tests and investigations just to just to understand the right diagnosis. Okay, and here there are some 3 more cases just to think about. And the task is similar: reassure the parents about the future. A mother or father presents with a child who, the first situation, who has pricked his finger on a dirty needle in the park. And the parent is anxious the child might get HIV or AIDS. What do these letters stand for? HIV. What does it mean?
Human
Human immunovirus.
Human immunovirus.
And
Immunodeficiency virus. Yes, and
acquired immunodeficiency syndrome.
acquired immunodeficiency syndrome.
syndrome. Yes, you're right. Okay. The second situation. So a parent presents with a child who is about to have an MMR vaccination. What do these letters MMR stand for? You remember?
Measles, mumps, and rabies.
Mhm.
Mumps,
Rubella. Rubella. yeah.
Rubella, ma'am.
Okay. And the third case is a parent presents with a child who has swallowed a small silver coin. So let us just think what would we say in the first situation with the dirty needle. So
If
Not all dirty needles are
Mhm.
infected with HIV.
yes, it's not necessarily infected. Okay. What else?
We'll conduct some tests and hope for the better result.
Just to make sure that it's not the case.
and if it would be like if it causes AIDS or something, then the symptom might be pneumonia or something like that. So yeah, test could be done, could be made.
But it doesn't develop just so fast. So it should take time. Okay. So any more ideas about this situation? So the parents are very upset. They just scared. Okay. So what about the second situation? It's not so just serious like MMR vaccination, but anyway, the parents are worried about side effects and that something might go wrong. What would we say in this situation?
Assure them that vaccinations are safe and good for them in the future.
Okay.
And might develop a mild fever or some other symptoms, very mild symptoms.
Rarely they develop side effects.
So not to be concerned about them.
See, okay. Anything else? No? Okay, and the third one is for a parent with a child who has swallowed a small silver coin. What can we say here in this situation?
I suggest the patient to eat lot of foods like bananas, which easily digests.
Just to help the coin go out naturally, right?
Yes, ma'am.
Mm. Okay, good. Well, thank you for advice, my doctors. And so there is the task, the listening task here. So it deals with the just interaction between the colleagues. So sharing experiences with colleagues to obtain feedback and advice is a necessary part of the learning process. We're going to listen to a doctor training in pediatrics, talking to a colleague about a child who had febrile convulsions. And we should answer the questions which are given here on this slide. Have a look at the questions. And and we should start the listening. And you tell me if you can hear.
Listening 3. In the end, I felt I handled the...
Can you hear?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Listening 3. In the end, I felt I handled the situation better than at the beginning. At first, I got the child's name wrong. I was very nervous and unsure of myself, as I didn't have time to look at the notes made by the nurse or talk to her. This is just down to bad organisation. I felt the parents didn't like this, and it made them a bit edgy. But I recovered myself very quickly, and as I became more confident in what I was doing, the parents became relaxed, and the child became less agitated. I was very pleased, because they thanked me for being sensitive and being gentle with the child. I could see they appreciated the fact that I made an effort to make them feel comfortable. While overall everything went well, I learnt quite a lot from this experience. I should be more patient and prepare myself before talking to a patient. If I was short of time again, I would speak to the nurse first and get the basic details right. It is, in the end, all about teamwork and respecting the contribution of colleagues.
So let us answer the questions. Bhargavi.
Yes, ma'am. Was the doctor confident or nervous initially? He was nervous initially.
So Mayuka.
Was the doctor organized or disorganized? Disorganized.
Right. So Hita.
Yes, ma'am. Was the doctor empathetic or insensitive at first? At first, he was insensitive, but then later, he managed to calm down the parents.
Okay, so Rina, please.
Ma'am, did the parents and the child become less or more tense? I think more tense.
First they were tense, but when
Afterwards, less.
yes, when the doctor became more confident, they become more relaxed. Okay, so Vidya.
Did the doctor feel the consultation generally went well or badly?
Generally. So First, he was nervous, and
No.
then, but in general,
In general, it went well.
yes, it went well. Okay. Well, and Lahari,
Yes, ma'am. Did the doctor learn a little or a lot from the experience? He learned a lot, ma'am. Lot from the experience.
and what did he learn?
He learned how to be gentle and how to deal with the parents. I mean,
Mhm, mhm. And about Rohita, the seventh question, please.
Yes, ma'am. Would the doctor change anything in his approach or do the same again next time? Change anything in his approach?
What would he change? First of all, as far as he didn't talk to, didn't take notes from the nurse, so he would prepare, yes, before speaking to a patient, right?
Yes, ma'am.
So he would just get some basic details right. Mhm. Okay. And he says that this is a teamwork, and so everyone in the team should do his job. So just to deal with the patients. Okay. So and
Listening 3.
I would like you to look here. We are going to read some information about vaccination in the the UK, and so there are some recommendations for the use of the vaccine. Let us read the text, and you can see that there are two gaps here, and we should decide which sentence is better to use in each of the gaps. So let us listen to Sohita. Start reading, please.
Yes, ma'am. The objective of the immunization program is to provide 2 doses of MMR vaccine at appropriate intervals for all eligible individuals. Over 90% of individuals will seroconvert to measles, mumps, and rubella antibodies after the first dose of the MMR vaccines currently used in the UK. Tischer and Gericke 2000. Antibody responses from pre-licensed studies may be higher, however, than clinical protection under routine use. Evidence shows that a single dose of measles containing vaccine confers protection in around 90% of individuals for measles. Morse et al. 1994, Medical Research Council 1977. A single dose of a rubella containing vaccine confers around 95 to 100% protection. Plotkin and Orenstein 2004. A single dose of a mumps containing vaccine used in the UK confers between 61 and 91% protection against mumps. Plotkin and Orenstein 2004, chapter 20.
Okay, thank you. So here in the brackets, we can see the information. This is the reference to the research which was done by these people and which was published in some scientific journals or books. Okay, yes. And there is a second part. Let us listen to the next is Mayuka, please.
Yes, ma'am. A more recent studies in UK suggested that a single dose of MMR is around 60% effective against mumps. Herling et al. 2005. Therefore, 2 doses of MMR are required to produce satisfactory protection against measles, mumps, and rubella. MMR is recommended when protection against measles, mumps, and rubella is required. MMR vaccine can be given irrespective of a history of measles, mumps, or rubella infection or vaccination. there are no effects for immunizing such individuals because they have pre-existing immunity that inhibits replication of the vaccine virus.
Okay. And the next part is for Rina.
The first dose of MMR should be given at any time after the first birthday. Immunization before 13 months of age provides earlier protection in localities where the risk of measles is higher. The optimal age chosen for scheduling children is therefore a compromise between risk of disease and level of protection. If a dose of MMR is given before the first birthday, either because of travel to an endemic country or because of a local outbreak, then this dose should be ignored and
so what should be used in number 5? So at any time after the
ideally at 13 months of age. Ideally at 13 months of age.
Yes, in number 6.
The 2 further doses given at the no, ma'am, but residual maternal antibodies may reduce the response rate to the vaccine.
Yes, that is why it's done later. And in number 7?
2 further doses given at the recommended times after the first birthday and preschool.
So this is the schedule for vaccination of younger children. And you can see here, there is like diagram, just protect your child from measles, give your child the best protection against measles with 2 close doses of measles, mumps, rubella vaccine. So the first is 12-15 months and the second is 4-6 years old child should be vaccinated. And yes, and I would like you, yes, let us focus on the home assignment. So the home assignment, you'll have 2 just tasks, like one of them is a grammar task where you have to complete some grammar exercise with the correct form of the verbs in the first conditional or second conditional sentences. And there is the task to make a video. Now this is video why I want to be a doctor. So you should just create this video and tell this story. So you should talk about in your video, you should answer the questions like which are suggested here. For example, what factors made you wish to become a doctor? Is it a family tradition, personal beliefs, childhood dream, desire to help people, or some other factors? Or for example, you should also speak about medical education. Is it easy to get a medical education? And your future, where do you plan to work as a doctor? And what is the attitude of people towards doctors in your country? I mean, it's not you just answer these questions. You just make up a story, you write the story, and then you'll just think about this, memorize and tell the story looking at the camera, you see? So I've already just placed this task on the Moodle site. You can just have a look at the questions there. I put the questions there. And you should make 2-3 minute video record of your story and upload the video to your YouTube channel. And so just give the link, upload the link to the Moodle site. So as you've done with the previous video task. Those students who have some technical problems or other problems, so you may address to somebody in your group, for example. So the ladies who have already done this, and they can give you just consultation, just advice what to do, how to make the video, how to upload the video, these kind of things. Who can help? Can suggest the expert help. Mayuka, you are good at dealing with technology, right?
Okay.
So thank you. So please ask Mayuka, so she will recommend you what to do, how to do, if you have any problems. Okay. So that is all for today. So thank you for participation. Mhm.